Hi everyone, this is Dr. Cruz. I'm here to talk to you about Ozempic, Mounjaro, Zepbound, Wegovy, medications we're using now for diabetes and weight loss. There's a lot of confusion and a lot of people want to get these medications. So let me tell you a little bit about them. We are now using these medications a whole lot more in our clinic. One for diabetes because it's a very good medication. We're seeing the best numbers that we've seen in a long time as far as how well controlled their diabetes is with these medications. It does control your appetite and decreases the amount of sugar your body makes, so it works very well to help you with diabetes. We titrate up slowly as we go along. Which one do we use, Ozempic or Mounjaro? It really depends on your insurance company, what they cover, if they cover it or if they don't cover it. So we try to get that out. It's getting better as far as coverage for diabetics, as far as using Ozempic and Mounjaro, but if you are diabetic, then it's probably a good idea to look at your health plan to make sure that they do cover these medications. The nice thing about these medications is that it's an injectable once a week only, so it's very easy to use. The injection is tiny, and so most people don't even mind it. After the first time they put it on, they know it's not a big deal, and so they keep on doing it once a week. Now, we also have the other medications called Wegovy and Zepbound. Ozempic and Wegovy are the same medication, they just have different names. And one is used for diabetes, which is Ozempic, and Wegovy is used for weight loss. Mounjaro and Zepbound are exactly the same thing. Mounjaro is used for diabetes, Zepbound is used for weight loss. I like using these medications for weight loss now because we don't see the adverse effects that the older medications that we used to use for weight loss have. And these are actually very beneficial to you when you actually use them. They have a lot of good effects on the body, and they have a lot of studies going on, especially with Ozempic, stating how good it is for your liver, your kidneys, your brain, your heart. So there's a lot of good information out there that helps a doctor feel more secure about using these medications on their patients and knowing that they're doing a good thing for them. Overall, the medications have been very good. Most people tolerate the medications very well. There's been a few that don't tolerate the medicine, and that happens with any medication that's out there. So we start slowly, titrate up, and we keep on going until we get the desired effects. Usually with sugar and diabetes, if we get your hemoglobin A1C under 6.5, which is the start of diabetes, that's fantastic. And that's what we're aiming for a lot of the times, get you back to normal. If we can do that, that's fantastic. We can try to do that. With weight loss, we titrate up for the appetite to go away. And once that appetite goes away and we start seeing the weight loss, that's probably a good level to stay at. If we plateau and you're not losing any more weight or your appetite's coming back, maybe we go up a little bit more on that one. A lot of times it's a monthly increase that we do on the medications, and we go from there. I truly believe that you should use this medication under doctor's supervision to make sure that you are using it appropriately. So definitely talk to your provider so that they can help you out through this process. And for my patients that are out there that are diabetic and they're not using Ozempic or Mounjaro right now, definitely ask us about it and see why we're not using it. There might be a good reason to not use it. In addition, if you're looking just for weight loss, ask us about it as well, because there's a good chance that we can actually start that medication for you as well. And we'll do some other videos as well on this, talking about titration of the medication, how to use it, when to stop it. A lot of diabetics and people that are trying to lose weight want to know, when do we actually stop this medication? Well, maybe for diabetics, we don't stop this medication ever. There could be a point that you get to that you lose enough weight that maybe your diabetes is better controlled. We can decrease the medication and maybe sometimes take away medications as well. For weight loss, it just depends. Once we get to a desired BMI or your weight that you want to be at, maybe at that point we can start decreasing the medication and titrate it off so that you don't have to be on the medication for a longer period of time than what is necessary. And thank you very much for watching. We'll talk to you later.